Hi beauty, let's talk about urinary incontinence. So what happens a lot is that patients will tell me, oh, I really don't have it, or it only happens when I sneeze, it only happens when I cough, you know, it's very inconsistent, or I only had it a while ago, I don't have it now. And there's so many different like ways to be experiencing this, but once you're having leakage, it's almost in your, it's like it's in your favor for you to admit that, like, in fact, I do have this. But there's a lot of different types of leakage or urinary incontinence. Now, the two types that I really want to focus on today is going to be stress incontinence and then urge incontinence. I would say that that is the two most common types that I have patients come in with. And so the differences between them are, you know, it's fairly easy to like distinct them. Sometimes you can have a mixed one and there's other types, but let's just keep it to those two, okay? So with stress incontinence, you essentially have lack of like urethral support. A lot of it is a pressure control issue. So for example, when you are, when you're coughing and when you're sneezing, you have this like you have a burst of energy or burst of the muscle that's pushing down and everything is getting pressurized, and then your pelvic floor is having difficulty actually holding that in. And so sometimes that can happen to where you only have like a drop or two that you leak, or sometimes it can be like a full bladder loss control, right? Think of like jumping on a trampoline can be a common one, or even performing a squat. But with stress incontinence, it really is most commonly like sneezing, coughing, some kind of like where there's a lot of like holding of breath, and a little bit of like the diaphragm, the pushing that's happening onto your abdomen. Now with urge incontinence, sometimes you will have almost like an overactivity of the detrusor muscles. But with urge incontinence, what happens is that you, for example, like you put your key in the door and all of a sudden your body is like, I'm home, and you have this like overwhelming urge to go to the toilet and you have real difficulty holding it in. For some women it's that. For some women it's when they open the garage door. For others, they just go by the bathroom and they're like, whoop, my gosh, I need to go. And so having this overwhelming and overpowering urges to go, and then your body's inability to essentially hold it in. And then as you're walking there, for example, you might have leakage, or you got there safely, but the moment you start to pull down your pants, all of a sudden you're having leakage. And how you approach those can be really different, because like with urge incontinence, it's a lot of genuine like mind work and brain work to get you to a better spot. With stress incontinence is some of that muscle activation. It's a lot of what we'll call like down training, up training, where depending on how your muscles are functioning, that's how you go about the treatment. But it's important for you to know actually which type are you having, and maybe are you having both types, or maybe are you having one of the types that I didn't mention. But knowing that can be really helpful in regards to, you know, being able to classify yourself and or have somebody else classify you in regards to which one of those you have, so that then you can begin making it better. You can begin your treatment. But I hope that this was helpful, and just remember, when you know better, you choose better. And so if you've ever struggled with this, just know this is a very, very common issue. And just because you are a woman, regardless of whether or not you've had kids, this is not something that should be considered normal. And it's certainly something that you can improve and not have to deal with. So I hope this was helpful.